Yeah, it's interesting. And Jim, I've heard you talk before about the concept of, both for the purpose of simplifying care and for the purpose of lowering cost, the concept of red light, yellow light, green light medicine.
Yes, yes.
And tell me and tell our viewers what that means to you and how you see that maybe expanding.
Yeah, so, I've used the red light, green light, yellow light in the idea that before you see patient Jim, you need to know before you open that door, or even if that door needs to be open, if I have a red, which is a problem, a yellow, which is undiagnosed, don't know what the problem, or a green. So let's start with the easy one. If it's green, why am I there? Why am I in your office taking valuable time from other patients that you need to see? Just say, Jim, stay home, you're looking good. If I'm red, you actually either need to, let's say I have a retinal issue, you defer that to your retinal specialist, or you triage and you get them in the right category or immediately into your office. Where you're not able to spend the time, John, is with the patient with the yellow. You're not sure. But guess what? You're having to reduce the amount of time with that patient, and not that you, but a lot of misdiagnosis across the globe because they don't have time on the yellow. So you're throwing a dart. You're assuming you know the problem. And now, if we're able to have AI, where Miss Jim's profile is very similar to 1,000 other profiles that you have in your data system, you'll have that access to that information and say, 1,000 other people at Jim's age, he's a male, et cetera, et cetera. Boy, I think I can diagnose that yellow even better. So I say deal with the patient that's yellow, not the red or the green, and that's who you should be seeing in the office.
Yeah, I think that's really astute. And, part of the equation, I think, also is not just the biometrics that we're so good at calculating and measuring in ophthalmology, but also the psychometrics, what's going on between the patient's ears. It's probably the area that is our biggest blind spot in ophthalmology, if I can use that analogy, because we don't record particularly in a structured way what patients tell us in their history. Our record systems just aren't very good at that. And we don't consider it we consider it in our decision making an important part, but it's not treated in the same way that a macular thickness or an axial length or a keratometry reading is considered. And you mentioned our company, and I'm only going to talk about it for a minute, but so we have a company, MD Backline, that attempts to do that, and
Right.
we particularly focus on pre-op cataract patients so that we
Right.
can identify what kind of red flags might interfere with a good result with a
Right.
premium lens or with any cataract surgery, for example. And there are some fairly straightforward rules for doing this that we've learned over time and incorporated into it. But it occurs to me, and I'm going to stop talking now about our company and get your thoughts on the future of other startups. So you're involved with Avellino as a board member
Right.
and also Neurotech, but you also advise many other companies. You're involved on the investment side in small companies and through Octane,
Right.
the Orange County Technology Action Network, of which you were a founder. You influence and catalyze the success of hundreds of startups, many of them in healthcare. So when you think about the world now of eye care viewed through the lens of post-COVID, which startup type companies are more exciting to you then? Is it remote monitoring? Is it, tell us what you think, knowing this universe pretty well.
Well, I'll break it into two. I think the obvious answer is remote care. And again, I said that before, but I think it's going to be accelerated for a couple reasons. Not only necessity, but I do think that you're going to see investments by agencies, private equity firms that are going to be looking for that tremendously across the horizon of all entities. So the funding is going to be there for great ideas. The other thing is look at our industry. We're very little R, mostly D. All the big
Yes.
companies have acquired, okay? We've
Yes.
acquired, and then we make it a better mousetrap. And that's been what's happening here. I think in diagnostics it's even going to be more so. I mean, Zeiss is one of the few big companies that has a diagnostic division and a treatment division. Some of my other great competitors just treat. So I think the opportunity for true diagnostics in-office and remote care are only going to be accelerated, and then the private equity firms are going to be actually looking for those entities too. So you're going to have a unbelievable amount of wealth spent in that area. So I would say be there and continue to develop. And I think in cases of Octane, we're going to see more of those platforms than other. But now relating to the other categories, we still need to ground ourselves. You still are tremendous physicians dealing with diseases that have no known cure. Very chronic, very severe diseases. Retina, glaucoma, even cataract is still the leading cause of blindness outside the United States. And so we still need to keep ourselves grounded and realize we still have issues in our marketplace of technologies that are not meeting the needs of our patients. So I don't want to give the impression those are going away. I would say that the funding is going to be accelerated in the diagnostics platform. But if you're a really good innovator and you have a tremendous opportunity to help treat some of these very severe eye diseases, don't stop. But I think that if you do have an opportunity to increase your entrepreneurial attitude like you have, John, in that diagnostic, in this new environment where money will be somewhat limited, I think the diagnostic platform will be where people will bet their money on going forward.
You know, and I'm going to go back to cost for a second here. I think this underscores what you just said. The cost per patient episode of care is going to become an important measure, isn't it, in the future? And, you know, in the past, we focused a lot on premium services, not that they're going to go away, and we're going to talk about that in a minute. But you know, tell me, as an advisor to companies, as an investor in companies, as a potential acquirer of companies at Zeiss, how do you look at the cost per delivered care as in its importance, and is that now going to increase if you're advising startup companies?
Well, first off, I ask my customer what's important to them, and right now, again, pre-COVID, post-COVID, you've always said to me, and your peers have always said to me, my costs are going up exponentially. I can't continue to run my practices. And think about that. I'll give it a case in point. Why was private equity so successful in acquiring entities? Well, because they saw their costs going up and they couldn't continue in that medium. So they needed to have a private equity come in, help them consolidate practices. That's why private equity came in. If these costs were under control or they were managing, why would there be a need to sell your firm to a private equity? So costs were a problem, will even be more of a problem. Because I think we'll talk about this patient pay, which is somewhat of a concern to me, these premium type of procedures. But I will tell you, cost was and will continue to be a dilemma. And by the way, I'm speaking on a global basis here. This is not just a U.S. phenomenon. In fact, in some markets, it's even more so of a challenge. I mean, if you look at the European markets today, I am really concerned about what's happening in Europe. I mean, they have been more severely hurt than even in any other market. You know, I was talking to John Marshall over in the UK, and John has told me that they're now starting to look that you no longer can have specialty hospitals, that no longer are you able to have these specialty hospitals because they were not able to really handle the problems. So think about that. Is that a cost or is that just a productivity? I think it's a management of both. So cost will be an issue because that's what you were telling me prior. And we saw that with the consolidation of private equity.
Jim Mazzo, I want to thank you for joining us in this, which was the first segment of this conversation. And we will be releasing the second portion of the conversation shortly, where we will be talking about private equity and what it means for practices, where investment in private medical practices will be. We'll also talk about large industry groups like ASCRS and AAO and what future meetings will look like. And then finally talking about higher education on the whole, college and graduate school, which is a passion of yours and an area that you're very involved in personally. But for today, Jim Mazzo, thank you very much for joining us.
Well, John, as always, thank you. And you made it easy for me because you asked great questions. And anytime I can see your smiling face, it makes me feel better.
Thanks very much. That concludes the first part of this conversation with Jim Mazzo. I'm John Hovanesian. Thanks for watching.